Hi, my name is Michelle, and today I'm going to talk about teenage suicide. According to WebMD, suicide is the third leading cause of death among people between 15 and 24, with about 5,000 lives lost every year. Males comprise of 84% of those suicides. I want to talk to you today about preventing teen suicide. We will discuss teen suicide risk factors, what signs a teen may be suicidal, and what you should do if you think your child is suicidal. It is important to know the risk factors so you can help yourself or someone you know who may be thinking about suicide. The first main point I'd like to make is some of the risk factors associated with teen suicide. Some risk factors may be inherited, such as family history of suicide, psychological and mental disorders, especially depression and other mood disorders. Research also shows that children with low levels of serotonin, a hormone that the brain that balances mood, are prone to emotional disturbances, aggressive behavior, and suicide. Unhealthy, abusive relationships or a breakup, major fights in the family or at school, or divorce, peer pressure, social and academic pressure, turmoil in the family can lead to emotional breakdown. Substance abuse and or alcohol dependence. Easy access to methods or means of suicide. Always make sure guns, medication is put up and out of within the reach. History of physical or sexual abuse. Feelings of hopelessness, helplessness, financial loss, and bullying. People with risk factors need to be monitored carefully. There are warning signs to look for that a teen may be suicidal. Talking about or hinting about suicide. Always take these things seriously. Talking about or writing about death. Increased use of alcohol or drugs. Hanging around with friends that they normally don't hang around with. Grades failing. Feeling of hopelessness or helplessness. Withdrawing from social contact, mood swings, acting recklessly or aggressively, change in behaviors, change in normal routines, including eating or sleep patterns, giving away belongings. Sometimes a child may have an increased mood because they've decided to commit suicide, so they no longer feel those pressures. So you want to keep an eye on any behavior changes. If you see any of these warning signs, be prepared to act quickly. What you should do if you suspect your teen may be suicidal. If you suspect your teen may be thinking about suicide, don't be afraid to ask. Just asking isn't going to make them think more about it if they weren't already thinking about it. If you think your teen is in immediate danger, talk to him or her, take them to the emergency room, or call 911 if necessary. Immediate consultation with a mental health professional is a must. Local support groups and hotline numbers should be made available to teens so they can reach someone in crisis. Ask your teen to talk about his or her feelings and listen very carefully. Address depression or anxiety. Discourage isolation. Encourage physical activity. Safely store firearms, alcohol, and medications out of the reach. Keeping open communication with your teen is key. Get involved and know what is going on with your child. Know who they're hanging out with and what they're doing when they're not at home. Know teen suicide risk factors, warning signs to look for, and what to do if you think your teen is suicidal. Knowledge is key. Recognizing warning signs and acting quickly can help prevent teenage suicide. Hopefully, gaining knowledge can help us to reduce the number of teenage suicides. So remember, always keep the conversations open. If your child's grades are decreasing, or if you see difference in behaviors and sleep patterns, ask them what's going on. Don't be afraid to not bring it up, because knowledge is very important. Thank you.